Niger State government, in collaboration with UNICEF and the Republic of Korea, has convened a socialization meeting on a partnership grant aimed at maintaining and strengthening immunization and other essential health services across 10 prioritized local government areas. The event brings together key stakeholders to drive the implementation of the program targeted at improving healthcare delivery in the state. The event was held at the Haskell Luxury Hotel, Mena. Our correspondent, Kazaya Madu, completes the report.
While addressing the gathering, the Permanent Secretary, Niger State's Ministry of Health, Abdullahi Usman Iman, says the initiative is being driven through a stakeholders workshop designed to ensure inclusiveness and ownership among participants. According to him, the workshop will enable stakeholders to validate a workable plan that can be effectively implemented across selected wards to improve immunization coverage. He reaffirms the ministry commitment to the successful execution of Korean-supported program, noting that collaboration among all partners remain key to achieving the desired results.
This activity, which is a partnership between the Minister of Health through the Niger State Primary Care Development Agency, UNICEF, and in managing the grant by the Republic of Korea. It's being undertaken, as you can see in this hall now, through a workshop to make sure that all the participants are brought together to engender ownership and collaboration, so that when they go to the field, the work plan that is being validated and being tweaked to fit the local context will be applicable to all the wards that have been selected, which is 2 per LGA, the 10 LGAs, so that we can achieve the purpose for what it is, which is to strengthen both routine immunization and outreaches at the both facility and the community. And this is targeting this particular local governments where children who have never come in contact at all with any immunization service are being targeted, the so-called zero dose.
Also speaking, the Executive Director of Niger State's Primary Healthcare Development Agency, Dr. Inua Jinedu, explained that the state faces significant challenges, particularly due to its proximity to areas affected by insecurity. He says surveys were conducted to identify local government areas with high number of zero-dose children, those who have not received any routine vaccine. Dr. Jinedu added that 10 local government areas have been identified, and efforts are now focused on reaching and immunizing children in those underserved communities with support from UNICEF under the Korean grant.
We prioritize. What we did is that we took there is a survey that was quickly done. We did a quick appraisal then to find out what are those LGAs that have contributed the burden of zero dose, and then these 10 were identified as priority LGAs. So what we're trying to do here now is that with the Korea government, the UNICEF are now trying to implement to ensure that all zero dose are identified and then vaccinated. What we said, identify, enumerate, and then vaccinate. So basically that's what we are doing in LGA, but it's going to last for 8 months with this intervention.
On their part, the health officer, UNICEF country office, and UNICEF health specialist from the Kaduna field office, Madam Aisha Saulawa Kabir and Dr. Ahmed Sofo, says the meeting is aimed at sensitizing and familiarizing key stakeholders with the project and its implementation strategies. They note that participants, including officials from the Ministry of Health, the Primary Health Care Development Agency, and representatives from the 10 selected local government areas are expected to align on coordination and reporting processes to ensure smooth execution of the program. Dr. Sofo further explained that the Republic of Korea's support to Nigeria is driven by the country's higher number of zero-dose children, emphasizing the importance of targeted interventions to close immunization gap. The partnership is expected to significantly improve routine immunization coverage and reduce the number of unvaccinated children in Niger State.
The objective of this meeting is to conduct a socialization and familiarization meeting with the relevant agencies of Niger State government, namely the State Primary Healthcare Development Agency and the Niger State Ministry of Health, including primary healthcare officials from the 10 local governments, to discuss on the inception and kickstarting of the Republic of Korea Partnership Grant, implementation in Niger State. So the meeting actually aims to familiarize all relevant stakeholders in Niger on the project itself and on the intended activities, and to also agree the coordination of the implementation and the reporting, and to also finally agree what date to kickstart so that we will start implementation.
Highlights of the event are goodwill messages, review and validation of work plan, question and answer, as well as group photographs. Madu Kezia reporting for NSTV.